English Longitudinal Study of Aging, ELSA. ELSA Wave 11 Data Release Webinar, the 3rd of December 2025.
Well, good morning, everyone, and welcome to this webinar introducing Wave 11 of ELSA. For those who don't know, I'm Andrew Steptoe from UCL, and I'm Director of ELSA. Data collection in Wave 11 began in 2023, and the main interviews were completed by October 2024. But Wave 11 included a number of additional components, as you will see during this webinar, and I hope that you find it interesting. I should point out that this session is being recorded and will be made available on the ELSA website and the YouTube channel. I'd like just to say something about the questions. These will be addressed using the Q&A function. That's the tab at the bottom of the page. And the questions can be asked anonymously if you like, and they can also be upvoted using the thumbs up symbol if you want to move your question up the list. We'd like to encourage you to ask questions throughout presentations before you forget them. Some will be answered in the chat by ELSA researchers while the presentations are going on. Others will be answered by the panel during the data user session, which starts at 11:45. And with that, I'll hand over to Professor Paola Zaninotto, who is leading the overview of Wave 11. Thank you.
Thank you, Andrew. So welcome everyone, I'm Paola Zaninotto, Professor at UCL and the Deputy Director of ELSA. I will give you a very brief overview of ELSA Wave 11. So in Wave 11, we conducted approximately 6,400 interviews with core members and nearly 1,500 interviews with partners. The sample this year included about 1,000 minority ethnic groups. And as Andrew mentioned, the field work started in October 2023 and was completed in October 2024. We also had a self-completion questionnaire that was completed by nearly 7,000 people, including partners. And during this wave, we've also conducted health visits with core members for a sample size of approximately 5,000. So this wave had a continuity with the previous waves. So the core questionnaire content has been maintained. So we ensured that there was a strong continuity with the previous waves. Some modules have been updated and some topics added or removed. A small number of new questions have been introduced to reflect emerging research needs, and I will be talking about the module updates and new content now. In terms of modules being updated, this wave during the health questionnaire, people were asked about each diagnosed health condition anew. Specific references to the COVID-19 pandemic were removed from the questionnaire, for example, the furlough scheme. We modified the questions on internet use, and we reinstated questions on control and demand, as well as questions on neighborhood perception. In terms of new content, in the main questionnaire, we added questions on receipt of vaccine, expenditure on out-of-pocket healthcare, petrol and public transport, cutting back on travel because of higher prices. And then in the self-completion questionnaire, we included a module on climate change attitudes and beliefs. The health visits included tests on physical functioning and strength, such as walking speed, grip strength, and performance battery of tests. We also collected biomarkers, and this year the health samples were tested for a few more biomarkers, including progesterone, melatonin, and testosterone. And then we carried out blood pressure measurements and lung function tests. During 2023, we also carried out the second harmonized cognitive assessment protocol known as HCAP. We achieved a sample of just over 2,000 participants, and approximately of these, 1,000 were living participants from HCAP 1. This sample also included ethnic minority people, around 300 of them, and a random sample of ELSA participants aged 65 and over. The protocol was the same as ELSA HCAP 1, except for the smell test. Also, we carried out approximately 170 end-of-life interviews with a family member or carer for the HCAP 1 participants who have died. And that brings me to the end of this overview, and I will pass it on to my colleague Clément to talk about the end-of-life questionnaire.
Thank you very much, Paula. Hi, everyone. So switching to the end-of-life questionnaire, I just wanted to briefly talk about the rapid aging of the population. I looked at the trend in the UK. So this graph showed the share of people aged 50 plus, the target population of ELSA. So you can see that in 2002, it was only 33% of the population. And now it's going up until 38, a bit more today. And it will go until 42% in 2050. But if you just look at this graph, I think you would think the same as me. Where is the rapid aging of the population? But then if we look at the oldest, so people age 100 plus, this is changing very fast. So in the UK in 2004, it was only a bit more than 800,000 people age 100 plus. Today is more than 16,000. And this number will go up to approximately 50,000 according to ONS data in 2050. But you can see that this is changing a lot in the population, and people age 100 plus need a lot of care. And also the longitudinal studies that we have now, ELSA typically, people are close to the end of life. And this is why we have to think of accurate questionnaire and good questionnaire that can target all these different end-of-life trajectories. It's a bit blurry, sorry about that. So if you think of the different end-of-life trajectories, you have sudden death that can come from external causes, and this is usually minutes to hours. Then you have terminal illnesses, for example, cancer, and this is weeks to months. You, after this, have organ failure, for example, cardiovascular diseases. And this usually happen months to years with intermittent of people going to the hospital, out of hospital, or in different institutions. And now we have, with the graph I presently showed you, with the people age 100 plus, we have a lot of prolonged frailty. With dementia, for example, and this goes from 5 to up to 10 years. It really depends. So for all those different end-of-life trajectories, we are trying to have a good end-of-life interview that can have those information collected as well. So briefly, a reminder of what is the end-of-life interview. So it's an interview with a close relative, a friend, or a caregiver that knows what happened in the last year of life. And it collects information about health, care needs, social circumstances, and finance near end of life. And the aim is to complement the data collected earlier to really have this full life to be able to understand the different trajectories. And in the past, ELSA had this end-of-life interview for wave 2, 3, 4, and 6, and they had to stop because of funding reasons. But hopefully today it's again there, and it started with HCAP 2, and now wave 11. Between the two questionnaires, the same question remains, but a few of them were added in this new version of the end-of-life questionnaire. So the content is about the scenario on respondent death, the activities and help people need during the end of life, cognitive ability, challenging behavior, mental health. A new module was added on social, psychological, and spiritual support. Then sight and hearing, health problem and symptoms, Some new questions were also added on healthcare decision makings, which goes closely with all those research on advanced care planning. Again, the question on financing medical care, financing the funeral, employment, pension, will, and the value of other assets and life insurance policy. Paula already mentioned the response rate and the number of interviews for HCAP2. I put both in the same table because I think if you're interested in this topic, you can use all the data pulled together. Those are the statistics. So in total for HCAP2, we had 177 participants who entered the end-of-life interview for someone they knew. And for Wave 11, it was 347. And very brief statistic about those data. So the two combined, we have 42% of respondents that were children or partner of the person who died. 48% of the deceased were women. A participant died at age between 55 to 105. So you see it goes very, very high. And with a mean age of 82 years. Then 39% of participants died in the hospital and 33% died at home. 32% of participants died from cancer and 20% from cardiovascular disease. That was the main causes. And then 57 of deaths were expected, and 62% of deceased individuals were aware that they were actually at the end of life. So that was a brief overview of those very nice new interviews that were collected. And now we are switching to Darena with the life history module.
Hi, everyone, and thanks for joining us today. I will move to the live history interviews conducted as part of Wave 11. So first, why did we collect life histories, and why do we conduct life histories interviews as part of ELSA? So starting it in midlife, ELSA has very limited information about earlier life experiences of its participants. And we know from the literature that early life experiences influence later life outcomes. So the life study aims to fill this gap and provide a life course perspective, respectively help us understand better outcomes later in life. In the next few minutes, I will talk about the second life history interview, what's new, what's unchanged, and the data that is available. So we conducted the second life history interview in ELSA from November 2024 to up until March 2025. We invited just over 5,000 Wave 11 participants with no previous life history interviews to take part in the study. We mostly repeated the first life history interview conducted as part of Wave 3. Some modifications were made to the modules that we carried over, and but very few items were removed. We also expanded the content of the study with new measures relevant to Alzheimer's disease and other dementias. I'm going to focus on what's new, but just briefly, these include early educational experiences, cognitively stimulating activities, and childhood experiences, both positive and negative exposures. In terms of design, we employed mixed mode sequential design, starting with a web interview. Everyone was invited to take part online first, and non-respondents were followed by telephone interviewers. The most sensitive content of the study, the most sensitive questions were also offered via paper self-completion in the telephone interviews to help respondents recall events that happened earlier in their lives. We also used an event history calendar, and we achieved a response rate of 62%. On the left-hand side, I also included the details for the first life history interview, if this is of interest. So I mentioned that we carried over all the teams that were asked in the first life history interview, and this table illustrates the teams that were covered back in 2007, and respectively we included all those teams this time. We also have some entirely new content, such as social support and relationships in childhood, early educational experiences and social engagement, and provision of care. In the next few slides, I will go through this content. For example, as part of the social support and relationships in childhood, we ask participants about family health, relationships with parents and siblings. We asked about positive childhood experiences and loneliness in childhood, also experiences of being bullied. Another theme is early educational experiences, where we ask questions about educational activities with parents around the ages of 5 and 6 years old, self-rated abilities in maths and reading around the ages of 10 and 11, learning difficulties in primary or elementary schools, extracurricular activities in secondary school. We also asked them about the education that their parents completed in terms of how old they were when they finished full-time education. And we also asked some questions about cultural engagement when they were about age 30. Another completely new module for the life history is the provision of unpaid care, which lasted for 6 months or more. We asked about the people they cared for. We asked about the timing of care, the start, the end of the period, and whether this period is still ongoing. I said that we carried over pretty much all the content from Wave 3. So this is a very busy slide, and not exhaustively. It lists some of the changes that we've made this time around on the content from the previous life history interview. So what's important to mention is that for children, other than biological and adopted children, we also collected details such as sex, relationship, age of stepchildren and foster children. We also asked about unsuccessful pregnancy questions of men for pregnancies they may have fathered. We also asked about reasons for not having children if participants did not report any children during their participation in ELSA. In terms of the accommodation module, what is different is that the histories this time around were a little shorter, and they depended on the time that they joined ELSA. So starting from birth up until the time they joined ELSA, this is to minimize respondent burden, as we already have this information as part of the main interviews. What else we asked was for non-UK addresses, residences. We asked about town or region or district the residence was. We updated some of the items, such as those related to atypical living experiences and household amenities at age 10. We asked about parental background and accommodation-related discrimination. In terms of employment histories, again, these were repeated. We shortened the time for which we collected those. So this will be from first job up until they join the study. This time we called it occupation and industry, and this is available to users. What we did differently in terms of pay is that we collected pay for first and last job only, which was paid in UK currency. We also asked about experiences of education and work-related discrimination. Again, in the health module, we ask about ill health periods up until the time they joined ELSA. We expanded the health conditions list and asked for the periods, the start and end dates of adult ill health. We removed some questions on menopausal experiences, but these are questions that are asked as part of the main ELSA wave, so it wasn't necessary to have them in the life history. We added health-related discrimination questions and health behaviors. In the difficult events section, we added some more items with respect to stressful events, such as discrimination, violence, or ill health, and some of the items that were previously asked in other modules, they were asked here because this was also the end of the interview. And so they were just moved to this module or offered via paper self-completion in the telephone interview. This was an option. So what data is available and how it can be accessed by users? There are two separate data files for life history interview data that's been collected in Wave 3 and Wave 11. These original data sets are in white spell format. This means that the state variables are accompanied by timing variables. To the extent possible, we preserve the naming conventions so that we use the combination of the data in a harmonized file. The original data sets, however, can be linked to each other and also to main ELSA waves using the study identifier. There is technical documentation that accompanies the data sets that we made available. As I said, there isn't yet a harmonized data set for the Wave 3 and Wave 11 live interview subsamples. This is intended. There is a harmonized data set, however. Harmonization is achieved across share and ELSA live history interviews. For ELSA, this is the Wave 3 live history interview. So this harmonized data set includes state sequence data, meaning that a new state is available for each history module. The original data sets can be accessed via the UKDS under end-user license. The harmonized data set requires an approval from the data owners and special license. There is an extensive amount of research done already using the ELSA life histories, and these are just a few examples. ELSA life histories provide rich resource for analysis, and the extended life history data offers even greater research opportunities, including large and ethnically diverse sample, multiple birth cohorts, and expanded measures of relevant to Alzheimer and other dementias. So this is all from me now.
Okay, thank you very much. We're going to move to the next talk now, and we have the next talk is about future plan, and Darmi, I will pass it on to you.
Hi everyone, I'm Dami Kapadia. I work at the University of Manchester and I'm one of the ELSA co-investigators. And I'm going to talk to you a little bit about what's planned for the future in waves 12 and 13 of ELSA. So if we can go to the next slide. So the sample in ELSA, if we just think about what we're trying to do in future waves, so wave 12 is already in the field and that will be collected at the end of this year going into 2026. And wave 13 will be collected in 2027 to 2028. And we're aiming to interview approximately 11,000 respondents in each of these waves with the aim of having some refreshment samples of younger people so that we can try to ensure that each wave of ELSA data is representative of the old population of England. We're also aiming to increase the number of ethnic minority people within the ELSA sample so that we can actually use these data to do some analysis of ethnic inequalities for older people, something that we might not have been able to do before with ELSA. Next slide. One of the major changes coming into Wave 12 is the mode of data collection. So in Wave 12, we are asking all participants to fill in the questionnaire online first. So this is called a web-first survey method. For those participants who don't want to do it online, they can continue to do this as a face-to-face interview or a telephone interview. But this is a change that is happening, and that we'll see going into future waves as well. The self-completion questionnaire, which is a major part of ELSA, can be done online or in paper format by participants. And the health visit will continue to be in person. As we know, this is very important for collecting lots of data, biomedical, genetic and physical, which is used a lot by ELSA data analysts. For those participants who do what we call a partial interview, so this is an interview that they started online but may not have finished it, we will also follow those up with an in-person or a telephone interview to make sure that we get full data for that participant. And the cognitive functioning interviews will still be done over the telephone. Next slide. Just to give you an idea of some of the new content that we'll have in waves 12 and 13, we're already collecting some information on climate change, but we're going to introduce many more questions on this. So we're going to ask about behaviours such as recycling, climate change attitudes, adopting vegetarian or vegan diets, buying food locally, for example, environmental activism, and travel behaviours and how modes of transport might have changed. We're also hoping to develop and include more content on the lives of ethnic minority people in order to be able to do some meaningful analysis here. So things like people's migration histories, national, religious and ethnic identity, and experiences of discrimination across the life course. And the discrimination across the life course is something that has been collected to a certain extent within the Wave 11 Life History Questionnaire, as Davina mentioned. Next slide. And there is some information that we are recollecting in waves 12 and 13. So, for example, we will be doing an online nutrition assessment in wave 12. So previously in wave 9, we asked detailed information about dietary intake and food quality, and we are going to collect this again. This is particularly important in the current economic climate where food poverty is a huge issue, so we think this is really important to collect. And also to look at health outcomes as well. That's in wave 12. And then in wave 13, we are going to include again 7-day accelerometry to capture objective measures of sleep and physical activity. This is where someone wears a device to collect data over a 7-day period. And this again can be compared with data that's been collected in previous waves of ELSA. We also are going to collect objective hearing data in wave 13. This was collected 13 or 14 years ago in ELSA. So this will give us a chance to look at changes in objective hearing for our ELSA participants and look at the associations of hearing with things like cognitive impairment, Alzheimer's disease. And finally, as we've already talked about, the end of life interviews, which have kind of restarted in wave 11, will be continued for waves 12 and 13. And we're hoping to collect quite a lot of detailed information here, as Clement outlined. And these we think are really critical for understanding end of life care. So thinking about whether people's wishes were fulfilled at the end of life, well-being, interactions with medical staff and professionals, and financial costs at end of life. So next slide. And finally, just to say that some of you will have used the HCAP. So this is the Harmonized Cognitive Assessment Protocol. So this is an instrument which is used to measure and understand the prevalence of dementia and cognitive impairment in adults. So we administered this HCAP in 2018 to the ELSA participants. And we also issued HCAP2. The second time we did it in 2023. And we are hoping to do HCAP3, so this is the third time we will have done it, in 2028. And we're hoping that all of those people altogether, that sample will comprise about 2,000 people. And the content of HCAP3 will be comparable and similar to HCAP1 and HCAP2, so analysts can look at changes over time. And there's lots of information in there in terms of memory, executive functioning, attention, and there are also 5 dementia scales to evaluate a person's functioning. And I think that's everything from me on future content. Thank you.
Thank you very much, Taami. So we came to the end of our first session.
English Longitudinal Study of Aging, ELSA. Thank you for watching.